Dear viewers, your knowledge of pregnancy continues to grow. Today you will hear about the endocrine system, which changes significantly during pregnancy. I'm Dr. Olena Berezovska and I'm welcoming you to my YouTube channel. Do not forget to like this video and subscribe to my video channel. The endocrine system includes organs that produce hormones and other substances capable of hormonal activity. Hormones have a significant impact on women's bodies as they regulate numerous processes. Some hormones are very aggressive, so even a slight increase in the serum levels can lead to serious illness. However, the specificity of most hormones is that the active free forms are captured by proteins produced by liver, which convert them into inactive substances. In the bound form, all hormones have virtually no effect on the target organs and are excreted from the body by the kidney and intestines. The three main hormones that dominate during pregnancy and affect the functioning of many organs are estrogens, estradiol and estriol, progesterone, and human chorionic gonadotropin. The first two are produced by the mother's body, fetus, and placenta, and the third is produced by the placenta. Without the normal amount and ratio of these hormones, pregnancy will not progress. However, artificial interference with the balance of these essential substances can also result in abortion. Pregnancy is a new state of the female body in which both the fetus and placenta are active producers of hormones and hormone-like substances. The thyroid gland plays an important role in the successful course and completion of pregnancy. The thyroid hormones have similar structure with prolactin and other female hormones. Therefore, if the thyroid hormones are elevated or decreased, some organs may experience changes that resemble the symptoms of a variety of diseases such as edema, swelling of the breast tissue, and menstrual irregularities, which often cause confusion. Thyroid examination should be performed before pregnancy. Moreover, we should not use only ultrasound, which is often uninformative. Often the normal-like looking thyroid gland does not function well. Therefore, determination of thyroid stimulation hormone TSH is the first step in assessing the function of its gland. HCG, whose level is constantly rising during pregnancy, weakly stimulates the thyroid gland, and progesterone, on the contrary, reduces the function of this endocrine organ. Therefore, in the first trimester, the thyroid stimulating hormone TSH level usually decreases slightly. Also, it remains within the normal range. In the first trimester, TSH level is 0.1 to 0.5 milli-international units per liter is considered normal. In the second trimester, 0.2 to 3.0 milli-international units per liter, and in the third trimester, 0.3 3.0 milli-international units per liter. However, if TSH levels in pregnant women do not exceed higher limits, not higher than 5 milli-international units per liter, no treatment is required in such cases. In 20% of the women, TSH levels exceed the lower limit of the norm. During the second trimester, the thyroid gland may increase in size. The levels of hormones T3 and T4 may also increase as the concentration of thyroxine-binding protein increases, which is poorly filtrated by the kidney. After childbirth, the contents of these substances normalize within 4-6 weeks. Pregnant women have an increased need in thyroid hormones, and pregnancy suppresses the immune system. Expectant mothers are prone to autoimmune thyroiditis, which can develop into hypothyroidism after childbirth. In the first trimester, the Graves' disease often worsens. The condition can improve significantly during the second and the third trimester. Up to 8-12 weeks, the fetus is completely dependent on maternal thyroid hormones, which are supplied through the chorion and placenta. For example, thyroxine can be detected in amniotic fluid at 4-6 weeks of pregnancy. After 12 weeks, the fetus already produces its own thyroxine, but it's in small amounts, and until almost the middle of the gestational period, it still requires hormones from outside. Thyroid hormones are very important for development of the child, especially for the brain and the child's own thyroid gland. I discuss thyroid diseases during pregnancy in another video. Adrenal glands also produce more hormones during pregnancy, resulting in increased cortisol levels. This is normal and treatment is usually not required. See the next video for information on male sex hormones levels during pregnancy. Prolactin is an important hormone. Some women take medications to reduce its level in the blood. When they become pregnant, these women worry that their prolactin level will rise sharply, so they will continue to take such medications. There is no need to be afraid of high prolactin levels during pregnancy, and you should not take drugs that lower them. This hormone prepares mammary glands for breastfeeding. Under the influence of prolactin in combination with progesterone, mammary glands grow and the breasts become larger and denser in structure. A milky hay-like fluid may be discharged from the nipples, which is normal. The closer it's to childbirth, the more the discharge. The highest levels of prolactin are observed before labor. It is believed that prolactin, along with progesterone and oxytocin, prepares the uterus for childbirth and participates in labor initiation. It is before childbirth that the level of prolactin is the highest compared to any other period of woman's life. In pregnant women, the absorption of sugar glucose by the body tissues is impaired, leading to an increase in blood glucose levels. This is compensated by the fact that the pancreas produces more insulin. In contrast, the resistance of tissues to insulin increases, impairing glucose absorption. This creates a vicious cycle that can lead to gestational diabetes or diabetes of pregnancy. We will also learn about this type of diabetes from another video. In the second half of pregnancy, it is advisable that all women undergo a glucose tolerance test to determine how the body reacts to certain dose of sugar. From a diagnostic point of view, this test is better than usual blood glucose test. However, there are currently other methods for diagnosing gestational diabetes. For the most part, women with gestational diabetes do not need insulin treatment and can maintain normal sugar levels with a balanced diet alone. I will talk about other changes in hormonal levels in the future, so stay tuned for more posts and subscribe to my video channel. I wish you all the best and see you for the next video.